patients, including you yourself, are worth it, then men, we have to find a way to shift some of these tasks down the way, especially in our rural areas. I'm a man known for courage and saying it the way it is. Of course, from a political standpoint, an enemy, if I'm speaking just as enemy, I'll say, we have to be careful about tax shift, And yeah, we do have to be careful about it. But in reality, it is needed. We need an enemy that is like a big brother that can show even our other colleagues and other professionals in the healthcare industry that, hey, we will lead the way, we will engage, and we will show true leadership that's inspirational and motivational. And that's what we need. Of course, we always talk about healthcare financing, healthcare financing, healthcare financing. We need innovation with respect to most of these things. Innovation is the way forward. And innovation comes when people engage, when they look at the issues dispassionately and are truly ready to make change. Change doesn't come easy, and that's why you need leaders with courage. Because the first thing that will happen as a leader, if you want to make these changes, is that a large chunk of people will go against you, and that's why courage is necessary. The journey so far, I cannot leave this podium today without talking about my own life journey. Because I'm one of the brain gain, Abi. I'm one of the people who has actually repatriated myself. 10 minutes, that's even too much. In my 4th, 5th year in medical school in the University of Benin, I was a rugged guy. I was always in parties and all that. I'm sure you can see it from looking at me. And then I told my classmates that, hey, I've decided I'm going to be a brain surgeon. And what was their response? Of course, they laughed at me. You, neurosurgeon? February 18, 2006, I landed in the UK to pursue my dreams. And when I got there, they just said, fine boy, come and be a neurosurgeon. And they gave me, Abi? That's what happened, Abi. I worked as, there's a job called Peke. You clean toilets. You know, so you're cleaning toilets and then people are coming in the club and they are giving you coins. I did Peke. I worked as a nursing auxiliary as well. I remember when I was working as a nursing auxiliary and one of the ladies who's also a nursing auxiliary asked me, you're a doctor. My big mouth, I actually opened my mouth. I want to be a neurosurgeon. You a neurosurgeon? Go and clean that woman's buttocks, bro. I wish they could see me now. Through hard work, sacrifice, and going through massive challenges, and at every time, the thought of giving up, in my head I was like, hey, there are millions of Nigerians who don't even know me, who are depending on me. One of my consultants in my first year in my training in neurosurgery, Mr. Mo, he calls himself a vascular surgeon, but I never saw him clip any aneurysms. In Dundee, up in Scotland. He told me one day, my first year in neurosurgery, dude, you're struggling. Meanwhile, I just come from Nigeria. You're struggling. You're making mistakes here and there and stuff. If I were your elder brother, I would advise you to forget about this neurosurgery stuff. And what was my response to him? Dr. Mole, thank you very much for your advice and everything. I can tell you there's only one constant in this world, and that is change. Regarding the idea of me becoming a neurosurgeon, I actually have 2 options. And what are those options? Is either I become a neurosurgeon or I become a neurosurgeon because the Nigerian patients are worth it. And that's how I went through that, completed my training in 2014, finally got inducted in 2015 and did my subspecialist training in skull-based pituitary, vascular, and then I came back to Nigeria. My coming back to Nigeria was not by accident. Before I left Nigeria, my plan was to come back to Nigeria because the Nigerian patients are worth it. Does Douglas Emeka Okor sound like your average Nigerian doctor in the UK or US? No. It's going to be difficult to actually pull the numbers that you want back. Most of the people you see coming back, they are in private practice. They are people who are probably retired from the US or Canada and all that. It will be hard for you to see a chap who is going to be 43 years this year, who has a 16-year-old daughter who is completing secondary school and has an 11-year-old son who is starting secondary school back in Nigeria, his wife still back in the UK. That is not your everyday human being. It takes guts to live that comfortable life and come back here because you believe in your country and because the Nigerian patients are worth it. Nigerian Medical Association, thank you for this opportunity to speak to you. Nigerian Medical Association, you have the political leverage, you have the political muscle. It is time to build your political capital with the human beings in Nigeria, with the Nigerian populace. And you need to do this and do this for one reason and one reason only. The Nigerian patients are worth it. God bless the Nigerian Medical Association and God bless the Federal Republic of Nigeria.
I actually believe he deserves a standing ovation, ladies and gentlemen. Thank you. I would have asked, please, the applause you gave to him, is it for his height or for his energy? I am sure it's not equal to that. Please, a bigger round of applause for him, ladies and gentlemen. Thank you.